Dave had a migraine. Call this meeting to order. Today is April 13, 2022. This is a Program and Budget Committee meeting of the Community Mental Health. We already have had our oath of allegiance. The next item on the agenda is the Pledge of Allegiance. All stand, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Now a reading of the mission statement. Is there someone that would like to read the mission statement? Lori, thank you.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Lori. And before we adopt the agenda, I just want to recognize our new member, Brian Zajac. Brian, welcome. Have anything you want to say?
Nope, I'm good, thanks.
Happy to be here. Welcome, Brian. Adoption of the agenda. Is there a motion?
Support.
Motion by Lori, support by Megan. All in favor signify by saying aye.
Aye.
All opposed? Motion carries. Item number 4, hearing of the public. This is an opportunity for members of the public to speak to this board. Thank you.
All right, guys. I'm Lisa Lapine.
Lisa, turn your microphone on.
Oh, do you really need it?
We
Okay.
all need it.
Right there? Did it go on? All right, I'm Lisa Lapine. I'm with the IRC of Macomb. I'm also a Macomb County resident out in Harrison Township. Thank you for the great library. Wanted to just say, first of all, thank you for the increase that we did see. We need more. It's not enough. I'm going to keep saying that. I'm going to keep coming back. I'm going to keep pounding and pounding and pounding on it. Thank you, Dave, for listening to us and collecting the information from Wayne, from Macomb, Oakland, St. Clair, all the different counties, so we could provide you with rates so that you can see what other CMHs and PIHPs are offering to their providers. Understanding that this is not, money comes, money goes. The most important people that we can talk about are the people that we serve. And in order to give good quality, caring staff with appropriate training, it means dollars. And we take care of some of the most vulnerable people, most challenging people in the county. I'm sure you guys saw the news, saw the family who was talking about not being able to hire staff, has 2 individuals who are incredibly challenging and difficult to support. Regardless of how much I'd like to help them, I can't. I don't have the staff to send. And even in that situation, I'd be worried to send them in and be able to keep them safe. Both the individuals being served and my staff. And where I find myself is not only do I not have enough staff to support the people that I serve now, but if I take on another case and I lose staff because they get hurt doing their job, I can't do mine. So I'm going to keep encouraging you. I'll keep saying thank you. I am really thankful for the opportunity to partner. We've got some of the best communication going on right now with community mental health that we've had in years. I couldn't be more thankful for that, but the money's got to follow. And if the money doesn't follow, we still can't do our job. And what scares me and worries me about that is 298 and the idea that it's going to keep rearing its head and these things are going to keep being pushed for change. Because if we can't provide a system that supports the very people we are most responsible for, what can we do? And that's the challenge that we're going to have to face all the time. I had a really, really good opportunity to meet with Senator Shirkey and explain my position in opposition to the bills that he's attempting to introduce. And he told me, he asked me, why do you like CMH? And I got really quiet for a minute because I had to work. Because I appreciate my relationships, I appreciate that I know how it works, I appreciate where I know where I need to go in order to do business. And then I thought, but we kind of shoot ourselves in the foot because we don't do some of the stuff that we have to be able to do by not being able to provide adequate staffing support to the families out there. And unfortunately, we're proving his case for him. over and over and over again because we can't do the minimum. So I'm going to keep urging you guys, keep getting better, keep working harder. We don't want folks to be languishing in emergency rooms. I know it's not the philosophy of this administrative team, but we can't take on more until we can provide better dollars to the people who are providing the most intimate care for our loved ones. I even had the opportunity to talk with Mr. Habkirk recently and talk to him about 298 and what was going on in his life. It was very nice to hear from him and talk to him. But again, he was used to me being difficult and challenging and saying all the things that people didn't always want to hear. Next guy didn't care for that too much. Mr. Pankatide does a very nice job listening to the concerns and issues that I bring to the table. I can't be more happy with the open lines of communication, but we have to fix the budget problem. Thank you.
Thank you. Is there anyone else in the public?
Hi, I'm David Wagner. I'm from Life Skills Centers. I'm the executive director. I wanted to be sure to come here in person to say thank you all for the increase because it really makes a big difference, and we're trying to channel as much of that as possible into our wages so we can do a better job of recruiting. And that's really also why I'm here, is that we're now at the same rate as we are in St. Clair County and Oakland County, which we've been able to pay a little bit higher with rate increases that they've provided out that way. It really hasn't moved the needle too much. We still have many people who haven't returned to services who we were serving before the pandemic. We have referrals stacking up, just echoing a lot of what Lisa just said. I don't want to be repetitive. I know everyone has things they want to do. So I do think there will need to be more. And I always hate to be someone who comes up and says, hey, thanks for this, and can we have more, please? But that's the reality of the situation. The cost of getting our people out into the community, we're primarily a skill building provider, it's gone up astronomically. It's harder and harder to provide quality services to people and get them to places that matter. We do a lot of volunteerism, and it's wonderful, but our options are shrinking by the day. And that's a big part of it, and it goes hand in hand with the staffing. So I don't want to be repetitive, but we are concerned. We're all still struggling, and we're glad that you're here to hear us, and hopeful that we might be able to do more. So thank you.
Thank you. Is there anyone else from the public looking to speak? Hi.
Good evening. My name is Carmen Zimmerman, and I'm from Creative Care Services. And I just want to say the same thing. I kind of wanted you to see my face again, just to say thank you for what you did do for us, but we definitely need more. Our phone rings off the hook from families who need staff and they need people to care for their loved ones. So please hear us. Thank you for what you did, but we definitely need more. Thank you.
Thank you. Is there anyone else from the public? Going once, going twice, and there is a second hearing of the public at the end of the meeting. All right, moving on to item 5A, requesting approval for Teladoc Health Services Agreement. Is there a motion? Motion by Dana and support by Selena. Or Lori, support by Lori. And Dave?
You've approved a number of these at earlier meetings. This again allows us to, when we need to, employ telepsychiatrist. So this is another agency, and if you recall, Tracy Smith went through, she collects, I get a number of these in my email box. I send them to Tracy. She's filtered them down to the ones with the most reasonable hourly rate, which right now I believe is it's under $250 an hour. That's still a lot of money, but this gives us that flexibility as well. They don't always have psychiatrists readily available, so that when we have a need, we kind of go out to as many of these agencies as possible to try to meet the needs of our community.
Thank you, Dave. Any questions for Dave?
That's not what this is?
No, look at this packet.
This is my strength.
Oh, this is, well, Teladoc, what do you want? This is simply the renewal of the My Strength. Thank you, Sandy. Yeah, none of these are no wonder it sounded familiar. My Strength is the app. It's on our website. We make it available to everybody in our community. It's self-help, it's self-guided, self-directed, but we also do a lot of our trainings based on their materials. So it's a great resource, and I apologize for my earlier comments. Thank you, Sandy, for...
All right. Both good topics. Right. All in favor of Nick?
I'm sorry, Dave, one quick question, and I hope I'm on the right one now, because there were 4 and I can't think, I'm confused. But I think this is the one that said it was available to employees as well as our members?
It's available to everybody.
It's available to anybody. Okay, thank you.
You just need you need an email address, and then the password is on our website and stuff, but it's MCCMH in all caps, followed by COMM in lowercase. And then you have access to all of the services in there. There's meditation, it's self-guided, so for me, I have migraines, I don't sleep so well. It gives me exercises for all of those things. Diet, exercise, meditation, self-help. It's very robust, and it's a great resource.
Okay. Any other questions? All in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5B, requesting approval of RPC engagement letter compliance approval, and this was approved by legal. Is there a motion?
So moved.
Motion by Megan, support by Selena. And Dave,
This gives us the availability to have telepsychiatrists. No, this one is our compliance audit. We're looking at ways of doing this. Well, I'm sorry, as you recall, we had Raymond used to do our compliance audits, and now since they're acting in a different role, we've had to go out to another firm. So this is a contract requirement to do this annually, and we're just asking for your approval to use this agency to do our annual compliance audit.
okay. Any questions? Comments? All in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5B, requesting final, and Sandy circled it on my agenda, final approval of the MedVersant Master Services Agreement, which this was approved by legal, and also at the last program and budget, we already voted on this to move it forward. So this is final approval. And is there a motion? Motion by Lori and support by Selena. And Dave. Oh,
Hi. I'm so sorry I couldn't present this previously. It hadn't been approved by legal. It has been. There were a few periods that need to be moved and spaces and things like that. But essentially, this is phase 1 of the current contract that we're looking to start with MedVersant. They are a credentialing verification organization. They will essentially take over the credentialing services. They will check our primary source verification, such as validity of licenses, substance abuse certifications, DEA licenses, scope, authenticity of education, sanctions on Medicaid, Medicare, malpractice. They'll remind practitioners of licenses and credentials expiring to prevent lapses in service, organize all the credentialing files. This is an amazing opportunity for us to streamline this electronically. Currently, it's a very time-intensive and very paper-driven process. The other thing about it, there's a lot of room for error when people are uploading and faxing and sending you things, whereas this is a company that will actually go to the sites to do the verifications for us. Right now, we're reliant upon people to send us things. Approval of this contract will assist us with the fact that we have over 300 practitioners that we currently have go through credentialing and privileging, and we will be adding on in the second phase for the DCO agreements with the CCBHC. We're actually required to do credentialing and privileging. We don't have the number of folks that we'll have to go through, but they're estimating between 300 to 400 for the direct service organizations. So we're talking, 700 people that we'd have to run through our CMP committee. There's a large human error capacity that could happen there, and it does place our agency at risk. Basically, one of the other huge benefits of this company, Oakland uses them, Detroit Wayne uses them. If you go to Detroit Wayne's website, you can actually see the portal where people can upload. It provides reports for us. It does all of the legwork to reach out to make sure that people have their information available and on time. We'll collaborate with the UKG system as well for our employees so that they can upload some of these documents there. The project itself will be led by quality. MedVerson is NCQA accredited. That was one of the huge bonuses. When we went through NCQA, the pre-review, they're like, ooh, lots of things to fix here in terms of credentialing and privileging, but if this is a service that you use an NCQA vetted vendor for, then you're golden, and that's exactly what Detroit Wayne and Oakland did. Our project was a little bit more expansive because they will be creating our provider directory. We have been non-compliant with our audits from external agencies for an extended period of time because of our provider directory. We're required at all times to have a full provider directory that would actually list, are they accepting new people, what languages they speak, is the building ADA accessible, and things like that. Well, that's an ever-changing world. You get notices of providers changing. They will actually create that and keep it available for us for our upload on the webpage. So we've been meeting with them. They kind of gave me a really decent preview of what it would look like so that if we need to ramp up and ramp up quickly, which we really do at this point, labor intensive on the front end to get the folks that we run through credentialing and privileging, but after that it's incredibly smooth sailing. And we also asked that we could be allowed to do virtual committee processes, so situations in which an individual doesn't have to have clarification or verification or seek a gap letter, things like that, the committee can vote on them virtually instead of having 4 to 6 hour meetings every Friday to review these packets. So I'm kind of begging. I'm not gonna lie. And that's, any questions?
Donna?
Yeah, a lot of employees will probably have credentials on file with the department that they've had, in their records for quite a while, that they won't be able to upload. Will the department be uploading those files, or how will that be handled?
You entered a very interesting phase. So the state of Michigan actually is supposed to be actively engaging in universal credentialing. That was a bill that was passed. So the Michigan Department of Health and Human Services was responsible to create a universal credentialing protocol so that, Don, if you work in one county, all of your information would be available for any other county. That was supposed to have happened October of 21. They just started having meetings about it. Now we meet twice a week, but basically they're still at the phase that they're talking about what it would look like, how they can go about it. The information from Lara, for example, someone's license, all they have to do is pull that license and they can upload it. So that information is always going to be available to us as long as the person is licensed and they can give us the license number. Did that answer your question?
Well, I was thinking of things like your LMSW,
Yeah, that's their
where
license.
where you graduated.
That's the educational verification.
Yeah.
So believe it or not, there's actually a regulatory requirement that we verify their education, and MedVerson actually provides, they have a portal for that they have the ability to access that information, because there have been agencies that have identified that maybe that transcript wasn't from a university. So this will be an official check on all of those things. But basically for people that it's going to be an ongoing review, the every 2-year review, all that information will still be uploaded. We'll just have to run the verifications. The other huge bonus for us is they're running real-time checks. Right now, until I get an OIG sanction notice on a provider, I don't know. There's nothing in my brain that says I have to run all thousands of our providers, all thousands of our staff every single day to find out was there a sanction. And right now, the sanctions are coming fast and furious in the state of Michigan, and a lot of them on the behavioral health side. So I like this group to be able to run this check every single day on every person I have in their data bank to tell me there's a ping. Because it can take the Attorney General's office 2-3 years to let us know by the time they take the final sanction.
Thank you. Any other comments or questions? None? Thank you, Stacy. All in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5D, request to approve 10% rate increase for CCBHC DCOs. And is there a motion?
So moved. Support.
I didn't catch who that was, but I'm sure. Okay. And Dave, is this yours?
I told Brian we have a lot of acronyms, so whenever you say CCBHC DCOs, I've sat through whole meetings where that was just repeated ad nauseum. Our CCB, we are part of the state's demonstration project to be a certified community behavioral health clinic, or CCBHC. Under that umbrella, we have our own separate funding. Now it's a prospective payment system, and we need our network of providers underneath that umbrella as well. So the providers under that funding stream are called designated collaborating organizations. Sorry. For those, everything that a DCO does has to be reported to the state of Michigan as if we ourselves did it. So the credentialing Stacy just referenced, we have to do the billing, even all the third-party billing, the ability to pay, everything like that. So some of the changes that we've asked on the personnel side are in response to this as well. When we need to encourage our providers to cooperate with us, collaborate, and submit those services under that DCO agreement. When we look at that, there is some administrative changes regarding the providing of the credentialing and paneling documentation to us under the DCO agreements. They have to use our Focus EMR to enter everybody's service activity logs, progress notes, everything to support the claim, and then in turn we are doing the actual claim submission. Subsequent payments will be more burdensome to unravel, as we'll be sending SAL detail and not a regular EOB. So internally for each of our DCOs, they have to keep those services separate, the dollars, and make sure the accounting works on their side. Anticipate additional staff to handle new populations, and encouragement to participate in a program that the state sees great value in. So for those reasons, we wanted that rate differential under the DCO agreement, and this would be over and above any of the other rate increases that have been already approved by the board.
Any questions? Nick?
I guess I'm still a little confused. Over and above the ones we've already, so they got the 8.5% that we did before, they were in that list. And now this group, because of the added administrative burdens, will get another 10% hike? But
Yeah.
the others won't because they don't do the administrative work?
There's a lot of the services will be under the DCOs, and we need to encourage that growth. So we'll have tracking reports available. We'll be able to show the activity. I've already been in one meeting at the state level where they were showing the 14 CCBHCs that are in the demonstration, and our numbers were pretty low. So it's very important to us to Stacy said the clock was ticking on the CVO agreement. We need to get these agreements in place, and we need to start reporting the activity under them. It's important because they're going to be setting our rates, future rates, on the information that's submitted this fiscal year.
So this will then bring us in parity, close to parity with the other CCBHCs?
I don't know specifically what the other 13 CCBHCs, what their rates are. I don't know that.
Well, I thought I just heard you say the others were higher than we were.
No.
I guess I'm trying to figure out here, how do we make sure we're in line with the rest of the CCBHCs?
Some of them are CMHs and some are
Are not.
nonprofits. Like Easter Seals is part of the demonstration. So I don't have their rate schedules, and they don't have to share those with us, so
Okay.
their fee schedules, sorry. But we're trying to incentivize, when we reached out to our DCOs, the other part too is the third-party billing. So they're telling us that, if I can bill Blue Care Network for this service and get this much, and then, our Medicaid fee schedules are typically lower than that they don't have that incentive to report that service as they should, as they hopefully would, under the DCO agreement. So there is that consideration in there as well. And we're trying to collect more information about the extent and volume and cost under that.
And
third
this is
party.
paid for out of the new funding line for the Certified Community Mental Behavioral Health Care Fund?
Yes. Yeah, this is all under the prospective payment.
Any other questions? Any other questions? I have one, Dave, as a follow-up from Nick's, and that the funding source for this is separate than other things. Okay.
Yeah.
And this is a motion just to carry it forward to full board. So there's a motion and support. No other questions? All in favor signify by saying aye. Aye. All opposed? Motion carries. Receive and file. There's nothing under receive and file or resolutions. Other possible agenda items. CEO update.
I'm back. There's a lot of updates going on. So I do appreciate hearing from our providers, and I do appreciate the board approving the 8.62% across the board rate increase for the non-residential. We do have a 10% increase in place for the residential. We've done some hospital rate increases, and then one specific to the My Health Link program. We are currently looking at the rates for our psychiatric services as well, and I am scheduling a meeting with our core providers, the ones who are doing our intakes, because there continues to be some bottlenecks when people are calling us and then we're trying to connect them out. We're using our centralized calendar and we don't have enough appointments to meet our need. In March, we had our highest call volumes ever, so we'll see if that trend is continuing. But we know from everything that I'm reading that the needs of our community are increasing. Children, specifically the suicidal ideation and suicides are up. Substance use is up. So we're trying to prepare for that. So we need to have the psychiatrist available, and we need our providers able to use, I'll go back to my previous spiel about the teledocs. We need those types of resources available, and in this market, those rates have increased as well. So we're trying to make sure that we have the capacity to meet the psychiatric needs as well. We are looking to work with the ARCA Macomb for independent facilitation. It's a horrible term. Would you like an independent facilitator? Mm-hmm. Like, what is that? That our contract requires, and it's part of everybody's pre-planning. So before you go into the person-centered planning meeting, would you like somebody and from the outside to help you with your person-centered plan? And it's an independent facilitator is the term. What we're looking to do is work with the ARC, and then they would coordinate and have people available who are trained in the principles of person-centered planning, and then they would help the planning process go through and make sure everything was touched on and covered as it should be. The twist to that is I'd like to add a follow-up component to that as well, so that the facilitator would go back to the person 3 to 4 months later, and we're going to develop a questionnaire. Are you getting the services that were described in your plan? You know, are you happy? Are you satisfied? And they'll aggregate that information for us as well, and that'll be another data source that we can use to make continual improvements. I met with the leadership at the Arab American and Chaldean Council at their offices in Troy. They do have an office here in Macomb at 14 and a half and DeQuinder. They're very interested in expanding, and we're very interested in making sure we have additional capacity here within our network. So you've approved those kind of open-ended RFPs and everything else. We do have an agreement in place with them already. We would just be looking to hopefully add some volume underneath that. The staffing crisis, we did have numerous meetings at the state level. Al Jansen spearheaded that activity. In the state's redesign, Al is no longer on the org chart. He was the Director of Behavioral Health and Developmental Disabilities Administration. That's been eliminated, but Al continues on in a role at the state level, and he does have that information. We made suggestions, recommendations, and we vented our frustrations in those meetings. So kind of interested to see what they might come out with at the state level to help in that area. Of course, we'll be very supportive of that. And then I will continue to work with our local providers as well to address the staffing crisis as best we can. I am meeting with Senator Wozniak on Friday, and we have Senator McDonald coming to our north site on April the 25th. So, and board members are invited to our north site on the 25th. And it's just kind of a walkthrough for him, but we'll have the opportunity to share information about what we provide there. And again, our north site is the one where we're co-located with the MyCare Health Clinic for the integrated health. So they're invited as well.
Thank you, Dave. Any questions for Dave? Comments? Just a few reminders. We have a Recipient Rights Committee meeting on April 21st at 8. And we also have a nominating committee meeting on Monday, April 25th at 8, both in the admin building. And finally, our board meeting, our full board meetings on April 27th at 6 o'clock. Item 9, hearing of the public.
Ryan, before you move on, hold on. I had something real quick.
Oh, okay.
If you don't mind. Thank you, Mr. Chair. Sandy wanted me to tell everybody that everybody is going to get an email tomorrow requesting nominations for preparation of the nominating committee. That's all I got. Thank you, Mr. Chair.
Nominations of the nominating committee. Okay, sounds good. Linda?
I have one thing to add. It's not a committee of the whole, the nominating
Okay.
committee, so.
All right. Any other comments? Questions? Hearing of the public. Is there anyone from the public wishing to speak? No one from the public?
Oh, I don't get excited.
Okay.
So Lisa Lapine, ERC of Macomb County Provider Alliance, and I have to say something so you understand how my thoughts work as a provider. Stacy's up here explaining this thing that you guys are gonna get, right? And all I can think is, what does that mean to me? What does that mean? What does that mean? The logical part of my brain tells me that it really doesn't have a lot to impact me. It's going to be hospitals, it's going to be you guys, people that you're hiring and that's going to be on your staff. I get that. But the lack of funding that I have had me in such a tailspin. I had to really listen to what she was saying to calm myself down, because I don't have the money to buy a service to do what she's talking about doing. And it's an important idea and kind of an explanation to kind of bring you down to where we are as providers, because I'm thinking, well, I'm going to be doing independent facilitation and maybe I'll be doing this or that, but how am I going to pay for that? And it's a very, very real fear and very, very real concern, because all of the things that you do to improve what you do at your business usually trickle down to our businesses. And the problem is we don't have the cash to do it. We don't have the gerbils. My guinea pigs are dead. the machines don't run like they should. When a computer dies at the ARC, we do a ceremony because we don't know how we're going to replace it. We put all of our money, and most of the providers in this room put all of their money back into the people that they serve or the staff that serve them, because they have to in order to be able to give and be able to staff and support. So I just want to, it was a really good analogy for me to give you guys, because I really went into full-blown texting my CFO saying, oh my God, they're doing something here and I think I'm going to have to buy something. And I calmed down and I listened to what Stacy was saying. I'm like, oh, that's not me. But what if it was? And it's really an important concept, because one of the things that's seriously missing throughout the state of Michigan is consistency between the PIHPs and the CMHs with training, with record keeping, with reporting. What I have to do in Macomb is different from what I have to do in Oakland, is different from what I have to do in Wayne, is different from what I have to do in St. Clair, is different from what I have to do if I go into the Bay County area. And I have to have 5 different systems for that. And that means I have a biller for this system, and a biller for this system, and the biller for this system, and a biller for this system, and a biller for, and I don't get compensated enough to hire people at the right rate. So I just wanted to kind of give you guys a glimpse into what goes on in my brain for 7 seconds when it crashed, because I thought, I'm buying a new system, why? Okay. Thanks again for listening. If you guys ever want to come to York and see how it runs on a daily basis, call first. I'll have my slippers on. Please come. We welcomed Senator McDonald not that long ago. We've welcomed recently Senator Wozniak. We're trying to encourage state, local, federal legislators to understand what we're doing. But if you guys want to come and stop by for a day, we can show you staffing support, day program services, alternatives to guardianship, independent facilitation. We can give you a really, really good overview of everything that happens in the mental health system in one building. And we can talk to you and you can kind of see some of the challenges that we're facing. I know you get it and I know you hear it, but until you actually see someone stop in the lobby who doesn't have enough food to eat, I remember one time when Mr. Kinch was a director and I brought someone and left him in the lobby because I didn't know what to do anymore. And I just left them for Mr. Kinch in the lobby. I don't want to do that, but you can come to my office and see what it looks like. I just encourage you to kind of remember that when you guys are making those choices and decisions and it trickles down, our brains crash. I don't think I'm speaking out of turn, because I think everybody here probably twitched a little when we thought we might be buying something. So thank you very much.
Thank you. Anyone else from the public?
My name's Amy Davis. I'm the Executive Director at Friends and Family Incorporated, and we provide specialized res and CLS services in the county. I also want to thank you, absolutely. Everything that we've received has been greatly appreciated. Like Lisa said, we give it right back. I just kind of wanted to point something out. David spoke a little bit about the vocational programs and their inability to accept any folks back into their programs. And we're all in the same bank. We're battling for all the same folks. So the caregiver crisis is obviously, worldwide right now. And what's happening is when he can't hire anyone, to bring our folks back, we then are at more of a staffing challenge, right? Because then we need additional staffing when they're not day program. And we're kind of fighting with those same folks that are, working at Walmart and at Tim Hortons. And we really need to kind of rise above that to, be able to acquire those great caregivers. And the ones that we have, we're doing everything in our power to retain them. I know for us, a big challenge is we work with other counties. So I'm constantly trying to meet, I want to pay our Macomb County folks what we can do in Oakland County, And that's a constant battle for us also, is just kind of meet that wage and kind of close that, that wage differential there. So absolutely appreciate everything everyone's doing, and we unfortunately also really do need a little bit more so we can fight for those caregivers and get them back in our doors. Thank you very much.
Thank you. All right, anyone else from the public? Once, twice? Thank you. Item 10, adjournment.
So moved. Support.
Motion by Megan, support by Selena and Lori, and the whole board. All in favor signify by saying aye. 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 We are adjourned.